Now, let's just talk about a few other famous examples of statins and then we'll end the video. So, another famous example is a drug called Simvastatin. It is gradually going out of fashion. It was a drug that was massively in fashion 20 years ago, or even 10 years ago, it was massively in fashion. It was the first line statin for people to be put on 20 or so years ago. So it was really, really in fashion, but it's gradually been gone out of fashion and is being replaced by atorvastatin. So we wouldn't now initiate someone on simvastatin, we'd initiate them on atorvastatin. But you do still see people who are on simvastatin who have been on it for, 10 years or whatever. The dose is between 10 and 40 milligrams, and again, it is once at night, and I think often the starting dose would be 20 milligrams. I'm not completely sure because I've never initiated someone on simvastatin, but I assume that would be the rough starting dose. Now, why has this drug gone so out of fashion? Well, the reason is that it's the worst one for having the muscle side effects. Of all the statins, it's the one that's most likely to make people ache all over from taking it, and that's the reason that it has gone out of fashion. Another thing that I should actually say about the statins is that they interact with a whole bunch of medications, and this is actually another way in which statins could cause rhabdomyolysis. So statins are metabolized by the liver. So they're broken down. So this is a small picture of the liver. So they are broken down and metabolized by the liver cells into waste products that are then excreted from the body, and they're broken down by enzymes called cytochrome P450 enzymes, which we'll just abbreviate to CYP. So all drugs obviously have a pharmacokinetic profile as well as the pharmacodynamic profile. So statins not only work in the liver, but they're also broken down by the liver cells into their waste products that are then excreted. Now, there are a bunch of drugs that can inhibit cytochrome P450 enzymes and therefore can stop statins from being broken down and lead to them building up within the bloodstream. And if they were to build up within the bloodstream, that might mean that they build up to such dangerous levels that they can cause rhabdomyolysis and, for instance, hepatotoxicity as well. So there are a bunch of interactions, therefore, to be aware of. So you do not want to give a statin to someone who is also on a CYP inhibitor, or rather you do not want to give a CYP inhibitor to someone who is taking a statin. And major examples of cytochrome P450 enzymes inhibitors are the macrolide antibiotics, so things like clarithromycin, erythromycin, azithromycin, that are commonly used to treat all sorts of infections. So clarithromycin is used to treat lower respiratory tract infections, so chest infections, pneumonia, bronchitis. It's used to treat sinus infections, sinusitis. It can be used to treat, strep throat if necessary, if the person's penicillin allergic. Other things it can be used to treat, it can be used to treat cellulitis. Those are probably the major examples that come to mind. Erythromycin, another example of a macrolide, it's used commonly to treat acne. Azithromycin is often given as a prophylactic antibiotic to people who are really at risk of getting chest infections. So if you've got really bad COPD and you're getting infections all the time, or if you've got really bad bronchiectasis and you're getting chest infections all the time, people can put you on prophylactic azithromycin. So you do not want to give a macrolide antibiotic to someone on a statin because these are really potent inhibitors of the cytochrome P450 enzymes, and they're going to lead to the level of the statin going up within the bloodstream, and it then is much more likely to cause dangerous side effects. The other massive class of CYP enzyme inhibitors that come to mind are the Azole antifungal drugs. So these are a class of drugs used to treat fungal infections. The major example would be something like fluconazole. In fact, I've got more examples: ketoconazole, itraconazole. There are a bunch of other ones. And they can be used to treat fungal infections. Common fungal infections would be things like candidal rash on the skin that can form within the creases in the skin, fungal nail infections, fungal skin infections such as ringworm, but they might also be prescribed in much scarier situations. So patients who are on massive immunosuppressants, maybe people who have had organ transplantations and are on incredibly powerful immunosuppressants, or people on immunosuppressants for autoimmune conditions, or people who have had chemotherapy that has knocked out their immune system completely. These people can get awful fungal infections, systemic fungal infections, for instance, systemic candidiasis, horrible chest infections involving fungi, and these people may need to be put on things like intravenous azole antifungals. I mean, they're often going to end up on much more powerful antifungals than azole antifungals, so they might end up on something like amphotericin, which is truly poisonous, but may well save their life if they've got a systemic fungal infection. But if their condition isn't quite so bad that it warrants intravenous amphotericin, they may well be put on an intravenous azole antifungal, and be aware that those are also very powerful cytochrome P450 enzyme inhibitors and will therefore raise the dose of statins. So statins have interactions with cytochrome P450 enzyme inhibitors is the major message there, and simvastatin is the one that's most dangerous. Simvastatin plus clarithromycin, for instance, is a very common scenario that might arise. So it's common for people to be on simvastatin. It was a very in-fashion drug 10 or 20 years ago. So a lot of people are still on simvastatin, and these people might get a chest infection. They might be penicillin allergic, and therefore we want to put them on clarithromycin, but you should not, because clarithromycin will raise the dose of simvastatin within the blood, and you are then really, really risking horrible side effects from that simvastatin. So simvastatin is the one that's worse for side effects, which is why it's gradually gone out of fashion. But as I say, it was massively in fashion a while ago, so you will see a lot of people still on it.